How long does it take to recover when you do a reverse total shoulder?
So that's a great question. What I like to do is protect them for a couple of days, 3 days, just to let the incision kind of heal, get the covers off, so to speak.
And this is not done arthroscopically.
This is open surgery.
This is an open
surgery
incision.
that makes an incision in front of the shoulder,
Right.
to replace the ball and socket. But basically, you're waiting for that surgery to heal. The shoulder per se is ready to go.
So we're waiting just for the inflammation from a bigger incision to calm down.
2 weeks. Not in George's case.
Yeah.
But typically, I'll say, come off the sling after that numbing medicine is worn off, and start moving it. In fact, I get physical therapy involved, and if physical therapists can come to your house, we let them come to your house and give you that service. If you have to go to a physical therapist, that's great too. So we do that, and basically, from a shoulder's perspective, I like to tell my patients, if it allows you to do X, go ahead and do X. There is no true restriction coming from the surgeon's perspective to that reverse shoulder. Now, the regular shoulder replacement, I protect them for 3 weeks because there's a particular rotator cuff muscle that we have to protect, and that takes about 3 weeks to start healing. That we'll delay. So today I did 2 or 3 total shoulders. One of them was reversed. In fact, the person who got the reverse is already 3 weeks ahead on schedule as compared to the other 2. So it's okay, but the end point still is pain-free, good functioning, better shoulder than before, without pain.
Right.